Finds us. All right. It should come as no surprise that in the summer we are more active, and more activity can lead to more potential injury. Here to talk about some common injuries and their treatments is Dr. David Martin, an orthopedic surgeon and chief of orthopedics at the Connecticut Orthopaedic Institute at St. Vincent's Medical Center. Doctor, welcome.
Thank you.
Great to have you. So what are some of the more common injuries people suffer in the summer?
During the summer, many patients and people suffer muscle strains and sprains, tendon injuries, and often exercise use injuries. And this is often related to injuries and also the excessive exercise that one may partake in over the summer.
All right. How can these injuries be avoided? I mean, we still want to be active, right?
We still do. Activity is great. We first of all stay very well hydrated. Work on stretching. Stretching helps minimize injuries to the muscles and the tendons. And if you're exercising a lot, try to cross-train. Try to do other things so you don't focus on one area of your body. You use multiple areas of your body, and you can avoid a stress injury.
All right. Rotator cuff injuries seem to plague a lot of people. What is the technology and treatment? We hear about this all the time. Rotator cuff.
Still, rotator cuff can lead to a great deal of pain and dysfunction. The rotator cuff injuries can be treated without surgery, but there are some great surgical options. In the past, we've had problems with some of the larger, what we call irreparable rotator cuff tears, in which we didn't have that many great options. But over the last few years, we've had a new procedure that has become available where we take a small collagen pad and we arthroscopically place that into the shoulder, and it actually helps reproduce much of the natural function that the rotator cuff performs. There's also not FDA approved yet. There is a separate procedure that's being developed. It may soon be approved in the United States, in which a minimally invasive procedure in which a small biodegradable balloon is inserted into the shoulder, and that also reproduces rotator cuff function and has had really good promising results in Europe, eliminating pain and helping with function.
Interesting. All right. So as we age, hip fractures, a big concern, but innovations have made recovery a lot easier. Tell us about that.
Yeah. Well, we know that the sooner somebody has surgery for a hip fracture, the better they do. So we've made every effort to alleviate and minimize any of the impediments to getting patients to surgery. We make them a very high priority, and the vast majority of our surgeries at St. Vincent's are done well within 24 hours, which is great. So, and the other thing that we have is we have really great regional anesthetic agents which help minimize pain and allow you to mobilize and recover much, much faster. So we're better than we've ever been at treating our hip fractures.
All right, St. Vincent's Medical Center orthopedic surgeon Dr. David Martin, thank you for joining us.
Thank you.